Recently, I've been training a few professionals on how to use ozone in their practice, whether that's IVs or injections, or even the ozone sauna. One thing that is very rare is to find an ozone practitioner that knows how to do aesthetic injections with ozone gas. This is something that I learned when I was overseas over in Germany. It is basically microscopic amounts of ozone gas injected directly underneath wrinkles around the face, or it can be done underneath scars to reduce the appearance. Since ozone helps to create various growth factors and increase collagen and elastin within the skin, the ozone gas is a direct way of isolating specific dosages of ozone into localized areas. The treatments are typically done once a week for about 6 weeks, depending on the response of the individual. From what we've gathered over the last 20 years in our experience with ozone and doing this injection process, the results are really subtle in the beginning and then become more pronounced over time. It's nice because today there's, of course, Botox and fillers, which are an immediate response, but sometimes there can be too much filler added. Sometimes people can have some bad reactions to Botox. With ozone, it's quite minimal in both respects because you can't exactly inject too much of the gas, and you can't exactly have a bad reaction because, of course, ozone helps to mitigate a lot of allergic responses, and also is, of course, oxygen, which the incidence of a side effect with ozone therapy is about 1 in every 10,000 cases. So it's the lowest rate of side effect of any type of medicine. It works extremely well. It happens to be a completely natural way of doing anti-aging in the skin. And like I said, it's typically done once a week for about 6 weeks. When you, in between treatments, we would always have people use our ozone face moisturizer and our ozone skin salve. Okay, and that's the way that they could have a daily absorption of oxygen and ozone into those same areas. The ozone gas, of course, would speed the process along much faster. But the complement of the topical ozone, because it's in the oil, will slowly disperse the oxygen into the tissues, and it keeps a continual regeneration process occurring instead of just a once-a-week injection. So if you haven't explored antioxidant or of course, ozone aesthetic injections, I don't know of any practitioners that are currently using it on a large scale. I'm currently training, like I said, a few individuals to begin doing that. And I look forward to being able to refer patients to them for the injections. Until then, of course, we always want to suggest that if you are using any kind of filler injections or Botox, that you look into our products as a complement to them, because they do help your body to increase the regeneration process and speed everything up, while the actual aesthetic injections do their job, of course. So if you haven't looked into them yet, you can find our products on Amazon. They are also on our website at ozonecharged.com, and try them out. I think you're going to like them quite a bit.